Grief has touched too many people during the coronavirus pandemic, and although most patients who go to hospital with the virus recover, relatives and hospital staff too have had to cope with loss. In the second part of our special series, our health correspondent Gill Dummigan and cameraman Alex McCartney had exclusive access to the Royal Blackburn Hospital to see how those affected are being helped.
Last Monday, Susan and her mum were brought into the hospital. Susan's being treated on a general COVID ward, but her mum went to intensive care.
The surgeon off the critical care ward come to see me at night and said there was nothing more they could do.
Susan was with her mum at the end.
See my dad now. I did say to her, don't start falling out as soon as you get up there.
And how are you?
Numb. Numb because I've always lived at home. It was just me and my mum. So next time I go back home, it's just me.
Most people who go to hospital with coronavirus recover, but for those who don't, the end can be unexpected and swift.
That's really, really hard. Unimaginable to have your loved one disappear in an ambulance, maybe to hospital, and then the next thing you hear is that they're really poorly and then they might die. And you can't be with them, you can't visit always. That's really difficult.
Last week, the Royal Blackburn was able to start letting some families be with patients at the end. But some relatives are themselves too vulnerable to do that.
That's been the worst thing for us. Families not being here, people passing away without their loved ones present. Obviously, you know, our team have been great. Everybody that's come to help have been absolutely fantastic. They've all sat with patients, they've been with them, no one's ever been on their own. But it's mentally and emotionally draining.
The bereavement team has brought in more staff. They create memory boxes, use Zoom calls, anything to try to help families stay connected.
We've had lots of donations of little hearts. So the idea is that one heart stays with the patient and the other one is with the family, so that they're always connected even though they're not able to be together.
And do you think things like that help families?
I think, yeah, the feedback that we've had is that it's those little tiny touches that don't feel an awful lot, but they mean so much to families.
But the particular grief of the situation is also hard for staff to bear.
It is tough. And you know, you have a lot more dreams, you have a lot more nightmares, and it's hard having families as well because you worry about your families, passing it on to them.
The fear of catching the virus is an added stress.
You have this sort of sub-anxiety. You think about it, that am I going to catch it? As soon as you get a little symptom like a wheeze or a cough, you're thinking, oh, is this it? And you're constantly aware of that all the time.
To support them, the hospital has turned its chaplaincy into a quiet room.
You'll come in here, there'll be 3 or 4 people and we'll all just be chatting. A lot of staff just need somewhere where they can come, have a cry, have a little moment, and then go back onto that ward and give their all and give their best to caring for the patients and being there for them.
Hi, it's David here, the chaplain. Hi there, are you ready for your Zoom visit?
As chaplain, David carries out a lot of the Zoom calls between families and patients, both those with COVID and those without, like this one.
You okay, darling? You look nice and relaxed, sir.
Today's patient has been unconscious for some time, but has started to come round.
I spoke on Monday. You okay?
Yeah.
How's it been today?
It's been quite settled.
So how did that go?
It was really moving, but really good in the fact that the patient responded to hearing his family's voice. And he wasn't responding to the staff, but responded to them.
And that's the first time, isn't
And
it?
it's the first time, and what's really good is seeing the joy in their faces, because he has improved, so yeah, just seeing faces light up in his kids' faces, it's fab.
Small victories and acts of support.
I feel really emotional and really proud to be part of this great team.
It makes us feel more emotional and work together and it's like a family. Yes.
Yeah.
We're not overwhelmed. We are exhausted and we're tired and we're giving our best. But people are being really well cared for.
Gill Dummigan, BBC North West Tonight, Blackburn.